Dr. Wilson, what are stem cells?
So, first of all, our body is made up of many cells, trillions of cells, in fact. We have cells in our body that function as our heart, cells in our body that function in our lungs, our GI system. So we have many different types of cells. What stem cells are, they are the immature form of those cells, meaning it's the part of the cell before it becomes heart tissue, before it becomes lung, and so forth. And so there are two different types of stem cells that people usually talk about. One is called hematopoietic stem cells. These are the stem cells that become blood cells, cells in our blood. The other type is called mesenchymal stem cells. And this is more the type of cells that are being used for therapeutic purposes to help with inflammation and different disease processes in the body. Basically, these cells can be found on the outside of blood vessels anywhere in your body. And for instance, if you were to cut your arm, the pericytes, which are these cells on the blood vessels, would be released, and the mesenchymal component within those cells would regenerate new healthy tissue to help close up that damaged tissue at the site of injury. And so mesenchymal stem cells are cells that are in our bodies. They are used to regenerate new healthy tissue.
Dr. Wilson, is stem cell therapy safe?
Yes, I believe stem cell therapy is safe. Research has been done on mesenchymal stem cells dating back to the 1960s. However, the bulk of the research has been done in the past 10 to 15 years. Currently, there's somewhere around 4,000 clinical trials going on for mesenchymal stem cells. Out of all the studies that I have seen, and the doctors I've talked to who also do mesenchymal stem cell therapy, I have not seen or heard of any major adverse reactions to these mesenchymal stem cells. If anyone is interested in looking at some of these trials, you can go to clinicaltrials.gov and view some of these trials. Here at Interventional Pain Center, our patients receive umbilical cord blood-derived mesenchymal stem cells. These cells undergo a very extensive pre-screening process before they are administered to the patient. What happens is after a live, healthy baby is born, the umbilical cord is taken, and the blood within that cord is sent to a lab where they do various testing to make sure that there are no diseases in these cells. And so it is regulated by the American Association of Tissue Banks and is also compliant with FDA standards. Now, with that being said, there's always a risk anytime you introduce a needle through the skin. So if we do an injection in your knee, we do an injection anywhere in your body. Anytime you inject a needle, there's a chance that you could have an infection or bleeding or things like this. But that is independent of the stem cells. Here at Interventional Pain Center, we use two different sources of image guidance to make sure that we inject the mesenchymal stem cells in the correct location. One way is through fluoroscopic guidance, which is an X-ray machine. For example, if we were to inject the spine, somewhere in the spine, we would use an X-ray machine to help guide the needle to the precise location in the spine to make sure we deliver those mesenchymal stem cells to the area that is problematic. We also use ultrasound guidance. We use ultrasound guidance for peripheral joints and for tissues in the body, soft tissue injuries, and things of this nature. The purpose of using the ultrasound guidance is not only to make sure the needle is put in the correct location, but even more importantly, to make sure it's not put in the wrong location. For example, if we were to inject in the arm, we would want to make sure that the needle is not anywhere near nerves or near any blood supply. And so, using the ultrasound guidance, we can make sure that the needle goes into the correct location. You want to make sure if you're having an injection of mesenchymal stem cells that is being done or performed by a board-certified physician. Here at Interventional Pain Center, we have several board-certified physicians who are very well trained, including myself, on doing these type of injections. Now the question has been raised, Dr. Wilson, do you feel like this is safe enough to where you would do it on your own family member? And my response has always been yes. In fact, I have done it on my family member. I've done it on multiple members of my family and friends. I can assure you I would not do that if I did not feel that this was safe.